Living with back pain can be debilitating, and as we age, knowing the cause of that back pain can be difficult. One Valley resident says she got her life back after a long time battle with back pain, thanks to the excellent care she received at community medical centers. 72-year-old Linda Blocker started noticing stiffness in her back around 2017.
People would say, "Are you okay?" And I thought, oh, I guess they really notice. And I didn't even realize how bad I was.
Because of how severe her spine actually was, Linda couldn't even stand up straight or even breathe correctly.
And then I went to have my photo ID for my driver's license, and she goes, "We can't accept this unless you hold your head up straight." And it was like I didn't even know. Your whole life changes. You can't do the things you want to do.
She was suffering from scoliosis.
Adult deformity, it can either be a follow-up from just childhood scoliosis, or it can just occur later on in life due to degenerative changes. So usually it happens when spinal motion segments start to deteriorate. So whether that's, you start to have a lot of arthritic changes settle in, the facet joints hypertrophy, your discs start to lose their disc height, they start to desiccate, all of that, and then you start to get a curvature, either whether it's in the sagittal plane or the coronal plane, and then the sequelae of that is that you can start to have nerve root impingement, and then all the symptoms start from there.
Linda connected with Dr. Samia Ghaffar, an orthopedic spine surgeon at community medical centers.
Her deformity had progressed to the point where she was just hunched over, and she was having difficulty breathing at this point because her ribs were almost touching her pelvis.
Dr. Ghaffar says scoliosis in adults is more difficult to treat than in children.
But at that point, there's really not as much that we can do. And so at that point, we're treating symptoms and we're treating more their quality of life. Is their pain or their cosmetic deformity or any of the issues that they're having, is it debilitating enough that if we operated on it, they would be happy with the outcome?
Because of Linda's age, there were questions regarding treatment.
There's a lot of things you have to look at. They can have osteoporosis, they can have multiple comorbidities. There's a lot of things that go into a spine surgery deformity correction at her age. We as surgeons our goal is to help someone achieve their own goals, and so I never operate on someone unless the patient and I are on the same page. And
it was like, this is a send. It was a miracle. It was like, you can really do it for a person my age.
Thanks to Dr. Ghaffar, Linda says she's now able to live a more fulfilling life.
So now I do yard work. I have little potted plants all over the place, and I take the dog out and we play, and it's much better.